campers, welcome to Camp Med's personal protective equipment mini session. You're going to learn all about PPE, how to use it, and how to safely use it and dispose of it. So, first, I would like to start off with a land acknowledgement. The Northern Ontario School of Medicine respectfully acknowledges that the entirety of the school's wider campus of Northern Ontario is on the homelands of First Nations and Métis peoples. The medical school buildings at Laurentian University and Lakehead University are located on the territory of Anishinaabe Nation, specifically Atikameksheng and Wahnapitae First Nation and Fort William First Nation. What does PPE stand for? PPE is an acronym commonly used in healthcare that means personal protective equipment. In healthcare, we use many different types of PPE to stay safe. So, what are the different types of PPE? In healthcare, we use many different types of PPE. The PPE that we use is dependent on the disease and the way that it is spread. Common PPE that we use in healthcare includes gloves, surgical face masks, N95 face masks, goggles, face shields, disposable gowns. Other pieces of equipment that is used to protect patients can include sterile gloves for certain procedures, or shoe coverings and scrub caps. These may be needed when a healthcare worker needs to go to the OR. So why is PPE so important? PPE is used in infection control protocols to help reduce the spread of diseases when coming into contact with patients who may possess these diseases. PPE helps keep us safe from becoming infected. PPE is important because we only have one healthy body and we want to stay healthy so we can continue to help others who are ill and need us. PPE reduces our risk when dealing with hazardous fields. It also protects us from harmful exposure, and it encourages us to be conscious of serious infection control protocols. Finally, PPE allows us to value our well-being going forward in our work. So just to summarize why PPE is important in healthcare, it helps prevent the spread of germs in the hospital. It also protects us from droplets or airborne viruses. Droplets are caused from people sneezing and coughing, and we don't want to inhale that. It also shields us from being in direct contact with blood or bodily fluids. It helps emergency staff when they have a new patient who they don't know the history of. It also helps cleaning staff who come into contact with dangerous chemicals. PPE also reduces accidents and improves the health of our employees and coworkers and allows us to work in a safe and secure environment. Especially with the COVID-19 pandemic, PPE is very important to be properly used as it can help prevent or even stop the spread of the virus. So what types of precautions are there? We have standard precautions, contact precautions, droplet precautions, airborne precautions. So the first type of precaution is standard precautions, treating all bodily fluids and blood secretions and excretions as though they may contain transmissible infectious agents. So for example, when you're performing venipuncture, you'd want to perform standard precautions so that you're not being covered with blood and being exposed to that bodily fluid. So type of PPE depends on the procedure, but you're always going to want to perform hand hygiene as it is one of the most important ways to prevent the spread of diseases between patients. So hand hygiene, the correct hand hygiene is so essential for breaking the cycle of the spread of infection. You need to wash your hands after handling each patient, even if you use gloves. According to CDC, the term hand hygiene applies to either hand washing with plain soap and water, the use of antiseptic hand rubs, including alcohol-based products, or surgical hand asepsis. So how often should we wash our hands? We should do this at the beginning of the workday, in between patient care, when in contact with patient's blood or bodily fluid, prior to an invasive procedure, before touching patients with high risk, after caring for patients with known communicable diseases, and we should do this if our hands are visibly soiled. So the next type of precautions is contact precautions. This is applied for diseases transmitted through direct or indirect contact with a patient or their environment. Some examples of this is multi-drug resistant organism, MDRO, C. difficile, intestinal tract pathogens. The type of PPE that we need for this is gloves and gown. C. difficile also requires special cleaning, so it requires a bleach solution to clean equipment if it's come into contact or been in that patient's room. Next, we have droplet precautions. Pathogens that come out of the mouth during talking, sneezing, coughing, or drainage of the nose. This is usually a diseases that are transmitted through close contact with respiratory secretions, for example, influenza or COVID-19. Droplet precautions include the need for gowning, gloving, eye coverage, and the wearing of a surgical mask. And all of these should be done if you're coming within 3 feet of the patient. Next, we have airborne precautions. This is used for diseases transmitted through suspended droplet particles that remain infectious in the air over long periods of time. So, some examples are tuberculosis, measles, chickenpox. The type of PPE that is needed is an N95 respirator, gloves, and a gown. There are different sizes of N95 masks, and healthcare providers must be tested to determine their size. Also, the patients are typically in a negative pressure room with air filtration systems when this is possible to reduce the spread. So, when should we use PPE? Anyone who might come into contact with blood, bodily fluids, or respiratory secretions should plan on wearing PPE. Eye shields should be used for anyone working with bodily fluids and any other materials that can be projected towards the eyes, mouth, or nose. A mask that covers and filters the air going into your lungs should be used when working with diseases that have airborne properties. Skin protection, such as gloves and gowns, should always be worn when working with bodily fluids or contact type diseases. Gloves may also be used when working with materials sharp enough to puncture the skin, like needles, because these can transmit harmful diseases, and that extra protection can sometimes help you. So, how to safely remove and dispose of PP? It's important to identify what sites are considered clean and what are contaminated. So, the clean areas of PP are those that have not come in contact with the infectious agent, the parts that will be touched when removing PP. So, this includes the inside of the gloves, inside and back of the gown, ties, or elastics of the mask. The contaminated areas of PP are those that have been in contact with body sites, materials, or surfaces where the infectious organism may reside. This includes the outside, front, and sleeves of the gown, and goggles, and the outside of gloves. So the sequence of removing PPE is gloves first, then face shield or goggles, then the gown, and then the mask or respirator. Where to remove the PPE is at the doorway before leaving a patient's room. We remove our respirator outside of the room after the door has been closed, and we ensure hand hygiene is performed. To safely remove our gowns, first we unfasten the gowns at the ties with our ungloved hands. We peel the gown away from the neck and shoulder. We turn the contaminated outside towards the inside. We fold or roll into a bundle. Only the clean part of the gown should be visible. Discard this into the linen or waste container. Next, to safely remove our gloves, we grasp the palm area of the other gloved hand and peel off the first glove. We hold the removed glove in our gloved hand. We slide our fingers of the ungloved hand under the remaining glove at the wrist and peel off the second glove over the first glove, and we discard these gloves into the waste container. To safely remove our goggles or face shield, first we use our ungloved hands, grasp the clean ear or headpiece areas with our ungloved hands. We lift it away from the face and we place it in the designated reprocessing bin. So to safely remove our mask or respirator, first we grasp the bottom ties of the elastics of the mask or respirator, then the ones at the top, and remove without touching the front of the mask. We discard it into a waste container, and then we wash our hands or use an alcohol-based hand sanitizer immediately after removing all. Next, we have this donning and doffing PPE tutorial video to show you how to put on and take off PPE properly and safely.
To promote full functionality of personal protective equipment, it is important to know how to put it on and how to take it off. This process begins with hand hygiene. Hand hygiene is a process that should take place for a minimum of 15 seconds, and that this process will also be completed with either an alcohol or soap-based scrub. It is important that the healthcare professional will scrub and wash all surfaces of the hand, wrist, and nails thoroughly. Once this is completed, the gown will now be applied. It is important to ensure the right side of the gown is applied, as the ties will not work if the gown is inside out. We will begin by tying the neck of the gown and then the torso. It is important to note that both of these ties must be completely done up in order to ensure the full functionality of this piece of personal protective equipment. Once this is completed, the mask or respirator will now be applied. In this case, it is an N95 respirator. N95 respirators are used with patients who are being suspected of COVID-19 or positive of COVID-19. Once applied, it is important to ensure that it is snug to the face and to check to see if when you take a deep breath, if there's any way that you can feel your breath coming through the mask. If you can, it is not a good fit and you should try for a different size of mask. At this point, you will now apply your eye protection or face shield. Following that, you will apply your gloves. It is important to note that the cuff of the glove and the cuff of the gown do overlap, thus not exposing any surface of the healthcare professional's skin. Now, to remove the PPE, the process is universally the same, but in reverse. You will begin by removing the gloves by pinching the middle of the glove and crumpling it up into the remaining gloved hand. You will now put your finger underneath the cuff of the still gloved hand, rolling the glove up over the hand. At this point, if your hands are visibly soiled, please perform hand hygiene. If not, continue to remove the gown. When removing the gown, it is important to note to do this very slowly and meticulously. By not doing so, you could dislodge a lot of the organisms on the gown onto the surface of your skin and contaminate yourself. Ensure that this is rolled up and discarded appropriately. At this point, indefinitely perform hand hygiene, as the only remaining pieces of protective equipment are on your head. You are performing hand hygiene the same way as before for 15 seconds with an alcohol-based scrub or a soap scrub, and ensuring that all surfaces of your hand and nail beds have been thoroughly washed. First to be removed is the face shield. And this is also to be done very slowly, methodically, and discarded in the appropriate receptacle. Lastly is the mask or respirator. And this is also to be done slowly and methodically, and you're not to touch the outside of the respirator. One last time, hand hygiene is to be performed using the same steps and procedure as previously stated. Now you know how to properly don and doff personal protective equipment.
And that concludes the PPE mini session. We hope you enjoy the rest of Camp Med and all of the other sessions.